welcome back to Inside Guelph. A lot of us sit still, maybe it's in your car for a large part of the day or in your workstation, and you start to build up stress and strain. Well, we're going to help relieve that today with Dr. Mark Kubert. Thanks for being here.
It's great to be back.
Chiropractor extraordinaire. All right, who's susceptible to this kind of stress and strain?
Well, the part of the workforce that is what I like to call the workstation warrior. These are the people that get up each day, they sit in front of their desktop or their laptop for 8 hours or more, and they start to get the battle scars from that as well. And that includes back, neck, wrist pain, headaches, eye strain, and shoulder tightness. And what's even worse is that they'll start to not only have that pain, but also a loss of productivity, significant productivity due to that pain.
Are bosses listening to this? Because that's important. That's your bottom line right there.
It is. It's really important.
See, I'm always surprised when I hear this, because I thought when you're sitting still, so how could you be causing stress and strain? But it isn't. It is.
It is.
Just sitting.
It is. Just sitting there. Our bodies are actually meant to move. And so keeping our bodies in motion is a really important thing. One of the ways that we can start to look at things and what you can do to help relieve some of that stress that comes up from sitting is make sure that you have things positioned properly. So we talk about the ergonomics of our workstation setup. Some key things to check into are keep your keyboard at about lap height so that your arms can hang loosely. You don't want your wrists to be up high or down low.
So this is what we're looking at here. This is a bad one. And why is that bad? He's leaning forward?
Well, he's leaning forward. He's hunched and crunched. And so that's going to cause his neck to be looking down at the computer, and sometimes the head tilts up a little bit to compensate for that. The keyboard that he has there is okay, but again, if it was down lower as he is in the second picture, that would give a little bit more, a little more relaxation to it. As well with his chair, you can see that he has his feet flat on the floor with his knees bent about 100 degrees or so.
He doesn't have his legs crossed.
You're doing just fine.
All right. It's just a short segment, yes.
And another thing that we need to take in consideration is the telephone. If you have a phone with a handset, use the handset. Don't just cradle it in between your neck and your shoulder. That's going to cause things to tighten up. And more people are also using headsets right now so that they can be hands-free and don't have to worry about holding it that way.
Right, doing that. Now, I also saw on that, it looked like he had something that was pushing his computer forward.
Yes.
Why is that?
Well, for people, if they're using a laptop computer, laptops aren't set up very well ergonomically. They're just like an open book. So there are different stands that you can get where you can place your laptop in there, and that can hold the monitor up higher for you. And you can even get an external keyboard that you can plug in so that you can control where the keyboard and the monitor of that laptop are going to be.
Okay, let's say you're just receiving this information, but you've already been at your workstation for 15 years running, and you're sore. What do you do about it?
Well, as I said at the beginning, motion is one of the most important things for our body. So getting up every 20 to 30 minutes from your workstation to just shake things out a little bit, move around. Instead of emailing something to a coworker, walk over to their office and talk about it with them.
I can almost hear the smokers saying right now, yeah, I get up every 30 minutes and I walk around. He's not talking about that kind of movement. Yes. Yeah.
Another one is make sure that you're staying hydrated. Drink water. A lot of us like a coffee or a tea, but those have caffeine within them which dehydrate you. So I recommend drinking an equal amount of water with that coffee that you're having. Now I know some people are going to say, if I'm having water with that coffee, I'm going to be getting up every 15 minutes to go to the washroom.
There's your movement there.
Exactly, there's your movement.
Perfect. And seek out a qualified chiropractor we just saw some great pictures of the kind of treatment that we would see.
Of course, we can help reduce that muscle pain and tension.
Thank you. Okay, that's great advice.